Welcome back to Kid Focused Dentistry. Today we are working on reverse swallow. So before we begin the session, I really want to talk to you guys about some of the difficulties that we have with doing the exercises for reverse swallow. So the first thing, it is a habit. What that means is your child is doing something that is subconscious. So what we're really trying to do right now is taking this habit, and in order to break it, we need to convert the thought process to something that is conscious. So we really want you to help do these exercises with your kids, because this is where your kids is going to be able to take those steps forward. The first thing that we really want to talk about is to make sure that we do this as a daily exercise. With the daily exercise, what do I mean by that? We tailor these exercises where it's should require you only 2 minutes a day and should be very easily incorporated into your daily routine. And that's part of our therapy, is kind of sit down with you and trying to find when is the best time for you to do this. Because we find that patient has much better success if you do a 2 minutes daily versus, let's say, you go every 2 days and do 5 or 10 minutes of the exercise. It just not the same as that 2 minutes daily. The reason why is when you first do the exercise, first of all, this is something that they've never done before, and sometimes it can seem really, really simple to the parents, but it is something that's very difficult for the child. So it's take them at least half a minute to a minute to even reset their brain to think about how they should do it. But if you do it daily, you're gonna build upon this knowledge. If you skip a couple of days and then do this exercise, what happens is your child is going back to square one. And we don't wanna do that. And that's gonna make your child frustrated, and it's gonna make you frustrated. So we want this to be a simple process and the easiest and the quickest for your child to learn, and for you, because we understand that, this is not an easy process where you do have to take time out of your day, and we understand a lot of you guys are very, very busy, so we want to make the most of this for you. So second thing with reverse swallow, again, this is something that we're trying to introduce a habit, and we want it to be a conscious thought on there. So we want to do this exercise with great intentions. What I mean by that is we're going to do step by step, and we want your child to really be involved in the exercise, to really think about it, not just giving them the water and ask them to swallow, because what it does is it's going to make them revert to the bad habit right away. So we want them to take their time. I want you to help them by taking your time to do the exercise. We'd rather doing it slow with intention rather than do a lot of repetitions and without intentions where you're not getting the most out of the exercise. The next thing is doing it in steps. So we designed this program because we understand that the moment you give your child water, they're gonna want to swallow it. And that's gonna make them not follow through with the exercise correctly. So doing it step by step, the way that we design it, is really gonna help break down the step consciously for your child, for them to, their mind to register, the muscle memory to start building. So then therefore you will get much better process of swallowing on there, okay? So in conjunction of doing it in step, we really want your child to do it in front of the mirror. So in front of the mirror is really, really important, because when they do these exercises, they don't have a visual of how the muscle should be. So as human beings, when we can visualize what we want to do, we do it so much better. Without that visualizations of what they want to do, it's a lot harder, and a lot of time your child can be doing something wrong and not realizing that. So doing it in front of the mirror is really going to help build that process, that picture in their mind for them. All of our exercise is going to start with finding the spot. The first session, that's all we want to do is find the spot. It seems very simple. It's not simple because it's not something that your child have done. So we want to kind of go back and touch up on that a little bit. So this is a great model. We're going to show you where the spot is. So if you see this little star right here, right here. So that is where the spot is, right behind the two front teeth, but not quite touching the two front teeth. What I do is I will put my tip of my tongue right behind my two front teeth and back up a little bit. But it's good for your child to, when they first doing it, for you to help them find the spot in front of the mirror. So this is the start of all of our exercise. We need to find the spot first. So basically you get into the front of the mirror and tell them to tell your child to show you where the spot is. So here, so once they put it in there, we're like, okay, now once they find that spot, the tip of their tongue need to go up on that spot and hold it there. So I would like your child to hold it about 15 seconds to 30 seconds, but they need to visualize where that spot needs to be. And what you're gonna tell them is that tip of that tongue is not gonna move at all when they swallow. Okay, so that's very, very important, because once that tip of the tongue is holding on to the spot, the tongue is going to naturally do a nice roll. But if the tip of the tongue is not holding on to the spot, they're going to start moving. So that's where we start going to get into the reverse swallow. The second thing, very, very important thing is when we introduce the water, they need to first learn to hold the water. So this is important because we don't want them to automatically go and swallow the water. We want them to feel where the water is at, so then they can begin the journey of swallowing. What we like to do in therapy is we do the game called Simon Saying. So once we give them the water, they are not allowed to swallow until we say swallow. Simon says swallow. So once they do that, they kind of get into that game, say, oh, you know, I'm not gonna swallow. I'm gonna hold it until my mom tell me to swallow that, and that's very, very important. So I'm gonna get Miss Vika to come here, and many of you guys know Miss Vika in therapy, and we're gonna demonstrate this exercise on here, and hopefully that will make a little bit more sense. All right, so this is Miss Vika. Say hi.
Hello.
Okay, so first off, as you can see, I'm gonna hand Vika a mirror. So we're gonna put it down here just a little bit, just so then you can see. So I'm gonna hand her the stick so she can find where the spot is. So I wanna go ahead and find the spot for me. Go ahead and put your tongue up there. So I can see that she is finding the spot first, okay? So now you can close. And what we're gonna do is, you have the pipette that we give you guys, a much cuter one. So we are only gonna give 1 milliliter of the water. The point of this is you wanna give enough where they feel in the mouth, but not so much that they have a struggle and it's easy for the child to revert back into the normal way of swallowing. So I find that 1 ml is probably the easiest way to do this. And then we will increase down the line as your child is doing better with the exercise. We're gonna start out with 1 ml. So the first thing I want to do is remind Vika. Vika, is your tongue in the spot? Are you holding it still? Okay, so we're gonna tip her head just a little bit like this on there. So about 20 to 30 degrees, because this is when we first starting, we want to facilitate this swallowing. We don't want to make it too hard. So we want to tilt her head a little bit on there. And then I'm gonna have the 1 ml, okay? So I'm gonna put it on the sides. I'm gonna give you some water. Do not drink it. Find the tongue on the spot on there. Hold it. You have your tongue on the spot. Okay, Vika doesn't really have a reverse swallow, so this is not difficult for her. But on a lot of kids, you're gonna start this muscle getting tense right here, because they naturally want to use this muscle right here. So what you want to do is tap this. Start tapping this, and what you're gonna tell her to do is slowly swallow, slowly swallow. So I'm keeping an eye on her, because what I want to do is, so basically, you have an X-ray vision. The moment the tongue moves, you're gonna see this part right here move. So the moment you see that a little bit, and they also, what I like to do is with my kids is I have them to look in the mirror while I'm tapping on this so they can see themselves. So when it moves a little bit, they're like, oh yeah, I know, my tongue is out of the spot. So this is very, very important that they are involved and you are involved in this process. But by tapping this will help kind of remind them to relax this muscle right here. So we're gonna do it one more time on here. And what I like to do is about 10 times of this swallowing on there, okay? So it really should take you about 2 minutes each day, okay? So we're gonna put the water in, find a tongue on the spot, hold it there, hold it, and then hold it, and now you can swallow slowly, So she did great, no movement at all. But again, if there's a movement, so some of the trick that we like to do is when is there any kind of movement at all? So when you're, oh, the tip of your tongue came unglued. So what I do with my kids is I'm like, okay, stick out your tongue. And I'm gonna put some extra super glue on here. Okay, we're gonna find that spot, we're gonna hold it tight. We're gonna glue it on there. And then so, again, we're trying to create visual images for your kids, for them to kind of visualize, oh, I'm gluing it onto that spot. So the moment that they can glue on that spot, they can slowly swallow on there. So the progression is we're gonna have her lean back, like this. We're gonna do 10 times. And I would like you to do this for at least 2 days before you feel comfortable for her to move on. I don't want to rush this process. So for 2 days, let's say 2 days, she does well with her head tilt back swallowing. And some kids might need a little bit extra help where they tilt back a little bit more than this. However, if she does really well, and then we're gonna go straight into this level, and we're gonna do the same thing. We're gonna give them water, tell them to hold it, find the spot, and then slowly tapping and swallow. After you are comfortable for at least 2 days without any assistance, any movement, then you don't have to tap the spot and you can allow the child to slowly swallow. Because we want to see that progression. If you're not helping remind the muscle, will your child be able to swallow on their own? If they're having a problem just with the head tilt, what I would like you to do is do the swallow with the myo brace in. This is seem very weird and very difficult for your child, but this is very important because when they wear the myo brace, they're gonna know exactly where that spot is, and they need to glue their tongue to that spot. Because what happens anytime that muscle is moving, that means that they are moving or not knowing where the spot is. So we try to give them a definitive spot where exactly the spot is. So we're gonna do that until they're getting more comfortable with swallowing with their myo brace. The other thing too is if they are doing really, really well, and let's say we get into a straight level and they're swallowing really well, then you might want to you can increase the water a little bit more, but that's gonna really help your child to slowly increase on that. But I do not want you to move them too fast, or I don't want you to go back in steps. So let's say your child have a hard time with doing this, and you're gonna jump right back to the head tilt. We don't want to do that. We want to start any exercise. We wanna stick with it at least 2 days, because it takes about 2 days for them to register what you're trying to get them to do. If you move them too fast forward or too fast backward, then you starting the process over and over again without making that progress that you want to do. So just remember, give any kind of exercise about 2 days for them to get used to things before you say, oh, I'm gonna adjust this to make it a little bit easier or a little bit harder. That's mainly, let's wait 2 days. Let's say if they do this, they have a hard time, they would tilt back on the head until they get that back and then go back here, but 2 days in between that, okay? So that is our reverse swallow. So if you guys have any questions, again, this video is to really supplement what we already did in the therapy. So then therefore, you guys should have seen all of this in actions. But if you still have any questions, just give us a call at 303-543-8338. Thank you.